Welcome to Perspectives in Peds, or PIP for short, your go-to podcast for insights into paediatric practice. From clinical approaches and emerging research to the everyday wins and challenges, we bring you OT perspectives that inform, inspire and spark conversation.
Welcome to Pipcast. Today I'm joined by Mikayla and Caity, and I guess due to a lot of requests for this topic, we've decided to flesh out sleep a little bit more. So Mick has had a lot to do with our recent booster on sleep, and Caity's informed a lot of that information as well. So we thought we would grab these two, get them on the couch and chat about some things to do with best practice and sleep. So I guess let's kick it off with just, in terms of why do you like addressing sleep, or what is it about sleep that you find interesting?
Oh, it's a good place to start, Jackie. I just find that sleep truly does impact, or I think impacts everything. If you have poor sleep, I think it really does flow on to all of your daily occupations, if we're going to get into real OT language. So I find a lot of the time by starting with sleep, if I guess there's improvements there, then there's often just flow-on effects from that. Yeah.
I actually just find sleep really, really interesting. And just a bit of a statistic here, the Heart Foundation reports that people spend a third of their lives sleeping.
Wow.
So when you think about that, I also think there's a lot of misunderstanding around sleep, and people just think, it's something that we do, but we actually really have to learn about sleep and how to sleep. And I think OTs can play a really huge role in it. I think it's fascinating, and I think it's a really cool topic to talk about and learn about.
Yeah, I think it's often a little bit neglected, isn't it, when it comes to sleep? Like, I think it's one of the pillars of health, like you said, and I think that we tend to accept bad sleep a little bit more than we would other things like poor nutrition, or if a child's having difficulty communicating or moving around, we tend to intervene. But when it comes to sleep, it's kind of like that's just that kid, or we have to kind of cop it. So I think that as clinicians, we really have a big responsibility to address it. But in saying that, I think sometimes we lack a bit of confidence addressing sleep. Why do you think that is?
Good question. I think it's those misconceptions around it. I think often when OTs think about sleep, we go straight to that sort of sleep hygiene or thinking about routines, which we know are super, super important. But I think there's lots of other areas that we can support with. And at times working on sleep can actually be quite prescriptive. And when you're looking at something that is quite prescriptive, you do need to have quite a bit of knowledge about it in terms of, what sleep disturbance are we potentially looking at, and what are the evidence-based interventions for those particular or challenges with sleep.
I agree. It's very complex, so it can be quite intimidating in terms of knowing where to start exactly.
Yeah, you really do need it's physiological, isn't it? So you really do need to have an understanding of it. And I think we get bogged down a little bit in the routines-based side of things, like Caity said, around, well, if we can just get them to sleep, then other things will rectify. But there's so many things that can happen around how long it takes to fall to sleep, excessive night waking, I guess our sleep associations and how we respond overnight, and I guess even more concerning sleep disorders and things that can be happening overnight, knowing when to refer on. When it comes to, I guess, OT specifically, what falls within our scope and when would you refer on?
I think a lot actually does fall within our scope. I like to almost say that we are really one of the only professions that are properly trained to look at sleep, and there's lots of other allied health that have a role within sleep, even nurses and things like that, but we are really well placed to support children and I guess other OTs, adults with sleep. I would be referring on for things like a sleep study when there are possible sleep disturbances, or even breathing problems is a really big one, looking at ENT and so forth.
Things like snoring.
Yep.
Yeah.
So more on the medical side, I would say, is when I would refer on.
Yeah, I think that's a really important point. I think having the confidence to know what to look for and when you need to get medical clearance is really important. But like sending people to a GP who can then refer on if needed and get all those checks done. And then post that, I guess they come back and they're like, no, it's all good. I still need help. There's so many facets to explore when it comes to sleep. So I guess that's where OTs particularly are really well positioned, but we know that we've got other listeners that come from a variety of backgrounds, and I think we all have a role to play. I think that I know for a lot of our sleep goals, there is a big anxiety element. So often psychs play an important role there. So yeah, we acknowledge that often it is a bit of a multi-dis approach to sleep when it really is a problem. I guess bringing it really back to OT roots when we're talking about sensory processing, I think sometimes we overcook it a little bit, or the emphasis on sensory and the role with sleep can be overemphasized, but that's not to say it's not a huge role. What is the relationship with sensory and sleep from your perspective, and how do you think about it clinically with the kids that you're helping with their sleep?
So I think about a few things. So one of the things that I think about is that obviously we know that if a child is, let's say super dysregulated during the day, and their, central nervous system is kind of all over the shop, we know that can then impact sleep across the night. So I think that's something that I think about. So how can we support the child to be a bit more regulated from a sensory perspective throughout the day, so that there's, more flow-on effects potentially throughout the night? I definitely don't think that answers all problems. The other thing that I think about is sensory strategies can be used to support sort of like those sleep associations. So things like, scent. It can be a really powerful sense, and it can be used as a bit of a strategy to support children in being like, oh, yeah, I smell this scent. Let's say it's lavender. Hey, it's time for me to go to bed. Yeah. So it can really signal or cue to the brain, hey, it's sleep time.
I know even for me as a little kid, I used to scrunch the ribbon on my teddies. It had and I used to scrunch that ribbon, and that was really like a sensory soothing thing for me. But we've got lots of kids that really preference, different kinds of sheets, or need certain white noise or no noise, certain blankets. You already mentioned scent, but also the type of lighting or no lighting. So we absolutely have to accommodate sensory preferences, and regulation is a huge one. And we know a lot of the kids we support find it incredibly hard to wind down and lower their levels of arousal ready for sleep. But I guess that's a huge role that we do play in that area. Is there anything else in terms of other sensory things to consider in terms of not just bedtime, but throughout the day or overnight?
It's another great question, Jackie. I just find that I almost view the sensory side of things with sleep as just part of the puzzle. It's rarely that we will only address the sensory side of things and sleep problems will resolve. I'm not sure if you both have had similar experiences, but there's often more, puzzle pieces that we need to look at to actually, get like good sleep.
Yeah, it's not just a matter of having some kind of sensory routine before bed and having a weighted blanket. Yeah, I agree. I think also some of the sensory elements, like there's evidence around it, like having, a cool but comfortable room. Like those kinds of things, like we don't want the room to be too hot or too cold. There's like your body temperature drops in order to be able to fall asleep. So we need to accommodate those kinds of things. So thinking about not just the child's sensory preferences, but optimal sleep environments from a more general sense, I think is important as well.
Like almost like a bed nest, or if you think about personally your own ideal bed setting or how your bedroom is, it really does make a difference, or personally it does. So it's almost like how can we set kids up for success in the same way, but if there's other things happening, then they need to be a part of the plan as well. And like you said, addressing sensory needs throughout the day, that's also important to I guess, build sleep pressure and things like that too.
I think when we're talking about sleep associations too, like sensory is such a huge part. I know even my husband and I, if we go away, we have a fan on every night in our room and it's not just the breeze, it's actually the noise. And if we go away and we're in a hotel or an Airbnb, like we'll be laying there like it's way too quiet. And if there's no fan or aircon to put on, we'll put like a fan noise on our phone and play it because otherwise we're just laying there wide awake and you almost fixate on the silence. It's so bizarre, but I'm like, I've got a very strong sleep association now with white noise and sleep as an adult. So we've really got to think about how important that is for kids, I think. I guess when we're talking about different sleep things that we consider across the lifespan, I guess, we're talking about the difference between early childhood through to adolescence and young adults, really. I've got a 3-year-old, so I'm right at the peak, that early childhood era. But what are some things to think about when we're talking about early childhood? Let's start there.
Sleep pressure is a big one. Sleep pressure, if you're not familiar with the term, is basically the longer you're awake, you build up the pressure to sleep at night. So I think often we come across trying to meet a certain sleep need based on your age or what I guess the typical hours may be. But I've learnt a lot through you, Jackie, actually, that your sleep need and how much, I guess, sleep pressure you're building throughout the day can actually change just depending on the person you are. It doesn't just have to fall into the hours for your age. So that's always a really, I think, important place to start for the younger kids.
Yeah, I agree. I think we take such an individualized approach to everything else, like food preferences and appetite and our ability to learn and, learning preferences and interests and play and all of these things. But when it comes to sleep, we somehow think kids fit all this like standard rule. Like where did this come from? It is so weird. Like, and obviously like there is a biological need to sleep. So there is a range in the same way that we need to eat. But there is an individualized sleep need that everyone has. And I think neglecting that is sometimes our biggest fault, I think, as clinicians supporting kids.
Yeah, and I was just going to add as well, I think it can be quite emotional for parents as well. But I think talking about those individual sleep needs and sleep pressure can be really helpful because it can support parents to be like, oh, actually my kid doesn't actually need that standard, 7:30 p.m. bedtime. Maybe they actually will benefit from going to sleep a bit later at 8:30 or whatever it might be. So, I guess like sort of those values or like I guess societal expectations also really impacts sleep and stuff as well.
Yeah. As a parent now, I really understand this pressure that people experience around you speak to someone who's got a good sleeper. So if yours isn't sleeping well, there's like all this just self-blame or there's this real undertone that everything a child does is due to their parent. And actually like, I think because of that there's either shame and then you kind of try to overcorrect it or, really panic about it, or you feel helpless so you just have to cop it. Like my kid's a crap sleeper, so it is what it is. Yeah. And actually neither of those things are true. There's always things you can do as parents. It's our job to support and learn and teach. But it's also not like any other thing. If there's a problem, we don't just have to cop it. There are a lot of things we can do and kids are individuals. So if you've got a child that has an average sleep need of 12 hours and you put them to bed at 7, they're probably going to sleep pretty well because they're going to get up at 7 and you're going to have a generally pretty good sleeper. If you've got a low sleep need child like mine and you try to put them to bed at 7, it's just not going to work well. Or sometimes she's tired and she'll fall asleep, but we'll have split nights, we'll have broken nights, we'll have early rising, we'll have nap resistance, and she's dropped her nap now. But I think that, we can really not cater to our child or think that we're doing something wrong or feel judgment when it's like, what time did your kid go to bed? Oh, 8:30. Oh, that's so late. Like kids should be in bed by 7.
Yeah.
So this kind of misinformation really feeds the issue, I think.
Yeah, for sure.
And then you're also talking about sleep deprived parents
Yes.
as well. So throw that in as well. And yeah, there's a lot of emotions around it.
Oh, it's horrible. Like sleep deprivation is, there's a reason like it's a form of torture.
Yeah.
Because like it is.
Absolutely.
Yeah, you're a shell of yourself when you have a couple of rough nights.
I mean, I can't empathize. I can't, what's the word, I guess,
Fully
understand what that might feel like because I don't have children. But when I think about one bad night's sleep for myself, I'm like, oh no, like this is going to be bad.
Yeah. And that's often what sorry, this is a bit of a segue, but that's often what I talk about to parents about as well in terms of like, think about yourself and when you don't get a good night's sleep, like think about how you respond the next day, and then it makes sense as to why your child might be behaving in a certain way if they're not getting enough sleep consistently. And it kind of shows like the importance of actually starting to work on it as well.
And also, like you said, we often ask families or the caregivers around what their sleep looks like as well.
Yes.
It tells you a lot about the whole dynamic and what's happening.
And what we know about co-regulation and all of those kinds of things as well, it's like if you're sleep deprived and your child is, they kind of need you to model and regulate more, but you're sleep deprived. So actually you've just got two people, me and her, just walking around the house grizzling at each other. So it's like,
vicious cycle.
It is a vicious cycle. It's like so counterintuitive to what actually needs to happen. So, I mean, when it comes to early childhood, I could get on my soapbox and talk about it all day. But I think that the shame around sleep really needs to stop. I think that there's so much that can be done, and there's a lot of people that really vouch for certain things, and they believe in that co-sleeping really works for their family, that only contact naps works for them. And I always say to families, it's only a problem when it's a problem. So there's plenty of things that work fine for the majority of kids and that works for individual families, and it's our role to figure out what families want to do, whether it's by personal choice or cultural reasons, and accommodate that, but also listen to families when it's not what they want and it's a problem, and not shame them into accepting another family's norms or a way of doing things. So, I think that it needs to be very individualized.
Well put, Jackie.
Thanks. If someone disagrees, come at me. I'm happy to have the debate. I guess we move on to school age. What are some of the other things we have to consider as kids get a little bit older and start to have more commitments?
I think this is where routines can be really important as well, because you're really trying to develop and kind of consolidate those routines. So I think that's something to really consider. But then also, still on routines, but obviously like school age kids start to do, extracurriculars and those sort of things that can then sort of impact that routine. And I think thinking about rest is really important for this sort of age group as well. So we know that sleep and rest are actually different. And when we think about rest, it's sort of that, that human downtime really. And rest can look different for every kid. It needs to, for an activity to be restful, it has to be easy or reduce cognitive load, has to be really enjoyable for that child. And we also want a reduction in sort of stress and anxiety. So looking at, how much rest is a child engaging in throughout their day-to-day routines or throughout their week as well.
It's such an important point. We just lead such busy lives. We can really overschedule our kids sometimes, and there's no rest or downtime. I think also anxiety, or the sources of anxiety, can change over the lifespan. Even my daughter's starting to be aware of monsters and scary things. Like she'll be reading a book and she's like, no, I don't like dragons. That's scary. So she'll wake and start to have the odd nightmare and things now. Whereas as kids get older, like we see older primary age kids who are worried about break-ins, and they start to, their anxieties change to more real world type problems that they think about during the day. And so, I think realizing how much anxiety and fear can play a part in falling to sleep, but also overnight and those kinds of things as well.
And I think when you go back to what you said around it only being a problem when it's a problem, because some bedtime worries are very expected and typical to like depending on the age, but sometimes it can be quite impactful when it's taking, nearly an hour to fall asleep at bedtime, and then there's stress and there's worry, which then isn't restful, like Caity mentioned. So that's, I think, a really important time when you should be resting is right before you go to bed. So it does all sort of link in that sense.
We also should probably touch on the fact that separation anxiety plays a huge role, particularly for some of the kids that we support, that I guess there's multiple layers to that, in that true separation anxiety wouldn't just be at bedtime.
Yep.
So I think we've got to, but that's not to say that lots of kids don't have difficulties separating. And that can cause a lot of anxiety. But when there is true separation anxiety, the approach we need to take needs to be quite careful as well, in that, any kind of stress chemicals are not conducive to sleep. So we don't want kids truly panicking when it comes to bed. We have to be very gentle in how we approach that, but also realizing that sometimes there is, a element of kids like what they like, and there is a sense of control when it comes to bed as well. And it's not always distress or expressing not wanting bedtime to go a certain way isn't always true distress or anxiety either. So I think being able to pull that apart is part of our role as well. What about for older kids, high schoolers, and what kinds of things do we need to consider there as their rhythm kind of changes?
I would say like their sleep-wake cycle, screen use in this age group obviously increases a lot. Or I guess maybe not increase, but they have perhaps more control over and autonomy over screen time.
And more access, I would say, as well.
Yeah, which does show to have a big impact on sleep using screens. So that's something really important to consider. And also just, the shift that we do start to tend to go to sleep later and then want to wake up later as well, which then school doesn't change, the hours don't change, nothing else usually changes. So
it's sort of those like circadian rhythms, isn't it? That sort of 24 hours, biological clock. It shifts, I think it's 2 hours later. So melatonin's produced 2 hours later. So obviously teenagers tend to be less sleepy until later in the night. And that's why like you often see debates around schools starting later and things, because their sleep-wake cycle is later, so they're wanting to get out of bed later. So obviously that can cause a lot of challenges for their sleep.
Yeah, and for families, because they develop a bit of a sleep debt. If they're going to bed really late, I'm going to show my age now, but when I was in high school, it was watching Buffy. So it was Buffy followed by Angel, and it was really late. So I'd be in my room like sneaking watching it on my little black and white TV that I had that my grandma gave me. And I had headphones that I plugged in and I could watch this little TV, but my parents would die if they knew that I was doing that. But you develop this sleep debt, and then I'd want to sleep till 2 p.m. on a Saturday. So then everyone,
from
get up, you've got
napping.
netball. And I'm like, no, I just want to sleep. So it's a really tricky routines-based time for teenagers, and some of it's normal. But again, if it becomes a problem, we do need to address it.
Absolutely.
When we come to like neurodivergence and some of the things that we need to accommodate, like we know that often ADHDers have low sleep needs, for example, and what are some other things we need to consider within the neurodivergent population that we support?
That's a good question. I think building on what we were saying before is sensory needs, and I know we spoke about them not being, I guess, the only piece of the puzzle, but they are a large piece of the puzzle, I would say, for this community. Yeah.
Yeah. I think also education around the statistics of sleep problems within this population, I think that's really important to discuss because, there's a lot of people who experience these challenges, but more so within the neurodivergent population as well. I think that's important to talk about, and also potentially thinking about medications and if they are taking medications, the impacts of that. So I know often this is where we look at that sort of, care team approach where we need support from pediatrician, from GP around medications and timing and those sort of things as well. What else would you sort of add to that, Jackie?
I think we support a lot of PDAs, so also internal and external demands of sleep. So
yes.
some kids might actually start to perceive that fatigue or that their internal drive to go to sleep as a demand, but then also just parents being like, I know I can't really present this as a demand, but like, go to sleep,
Yes.
for goodness sake, like I'm done.
Yeah.
And the role that like overtiredness then plays and dysregulation and those kinds of things almost are counterintuitive as well. What do you think, in addition to overlooking those things, are some like common pitfalls that we can fall into as clinicians?
In regards to addressing sleep?
Yeah.
I would say focusing on just sleep hygiene and positive sleep practices, they have a really, really important place. Don't want to underestimate that. But often the kids that we work with need more targeted approaches after that as well and more support. So sometimes, I would say, to summarize, focusing just too much on the bedtime routine rather than just or with like sleep itself as well.
I think as well, maybe not, like obviously we want to be family-centered and we want families and clients to sort of, guide their own goals. But I think having the confidence to actually speak to families and be like, actually, you've mentioned a lot of challenges around sleep. I actually think it'd be really good if we look at addressing these. I think sometimes we can be really focused on listening to the family, which is great. But when we're hearing these patterns, to actually, say, actually, I'm hearing this. This is what I'm thinking. What do you think about that? As well, rather than just sitting back and being like, oh, okay, they've said, yes, sleep's really challenging, but they want to work on, handwriting instead. Yeah.
I think as well, like just from experience, because sleep is very hard and complex, I might have a family work on it for some amount of time and make some progress and then want to move to something else before fully achieving the long-term goal. So I think to tie into what you were saying about the confidence to not push, but I guess encourage them to actually see out that long-term goal and keep looking at the family dynamics around how we can actually get there, keeping in mind sleep is a hard goal to work on. I think that's somewhere I think sometimes we fall short.
Yeah, and I also think it can also be as simple as like gaps in knowledge as well around understanding fully what our role is with sleep as an OT. Like I will put my hand up and say, like, early career, I had no idea in terms of my role with sleep. So I think like looking for more information, looking for PDs and things, because sleep is an occupation. So it's well within our role. And again, it's such a huge part of our role as well.
I think we've really worked hard to build up our knowledge and develop, like we're about to launch a sleep program here. So I guess cheeky plug, we've got, a PD booster on sleep if you want to learn a little bit more. But I guess one of the things that we've really learnt through our process of upskilling in sleep is the lack of assessment.
Yes.
I think we don't we jump to strategies and we don't assess properly in the same way that we would any other clinical area.
Yep.
And without good assessment and pre and post outcomes, our goals tend to be shitty. And if our goals are shitty, our plans are shitty.
Yep.
So I think we should be approaching sleep in the same way we would approach any other best practice goal area.
Yeah. I think addressing it from, I'm going to get really OT based again, but PEO is so important. I love the PEO because it really does like set you up for success and from a clinician's point of view, give you confidence that you are looking at every area rather than just looking at environment with the sensory or just looking at the occupation of sleep. You have to really look at all of it. I think that's important.
So that's person, environment, occupation for the non-OTs tuning in.
I was going to say as well, I think something that can be a bit of a barrier in terms of addressing sleep goals it is around how, like, it can actually be challenging to get really clear information on what's happening with sleep. So when you're talking about assessment, I assume you're sort of referring to sleep diaries and records and things. And I often find that sometimes for families it can be tricky for them to sometimes like fill out sleep diaries really in a detailed way, in the way we need them to.
Yeah.
And often I find it a bit of a barrier because families will also, to work on sleep, it can actually impact their sleep or the parent's sleep as well. So often when I sort of explain that to families, they can be like, actually, you know, we don't have capacity for that right now. So I think sometimes there can actually be a number of barriers in terms of addressing sleep sometimes as well.
Sometimes it's 2 steps backwards before a few steps forward with sleep.
Yeah.
And that's where so much of our role around education, like we need this information because of A, B and C, because I think sometimes like it's another data sheet or it's another thing, and it's like this is actually going to give us key information about sleep onset and night waking and calculating their sleep need. And if we can get all of those pieces together, we can actually write you something that will genuinely make a difference for you, and we will see improvement. Like that's one of the cool things about sleep. You really do see improvement, and you can work with the family. It can be slow, it can be fast. You can really it is one of those real tangible, nice goal areas to work on if you feel confident in it.
And really measurable goals as well. Yeah.
So I guess for those you know, a bit nervous to work on sleep, what are some really key takeaways that I guess are flags for you that you're like, for this family and this child, sleep should be the priority first and foremost? What are a couple of things that tip you over the edge to really knuckle into that?
I would say lots of sleepiness throughout the day, or perhaps having lots of naps when typically that wouldn't be a part of a child's every day. It's something that I explore further around, well, why are they so sleepy? What does sleep quality look like? What does sleep duration look like? I think that is important. And as well, when we've worked perhaps a lot on emotional regulation, and they perhaps have lots of skills around regulating but cannot implement them because they're tired.
Yeah, like
that's
sleep.
Usually when I'm like, let's
The
look at sleep.
deprivation is like undermining other goal achievement.
Yeah.
I agree.
Yeah.
I was also just going to add like parental mental health or
Great one.
parental capacity. I think that where sleep is just impacting on the whole family, I think that's a cue for us to have a really frank conversation about why we should be addressing sleep.
Yeah, I agree with all of those things. And I think some other things are just, you know, when the child cannot get out of bed in time for the things they need to do. So, for example, going to sleep or activities on the weekend, or when, you know, those routines around sleep, so bedtime routine or morning routine, are really, really challenging or stressful for the family, because often there can be like quite a bit of conflict around that as well. And I think that's, you know, some really clear indicators that actually this really should be a priority for you.
Or when the history, I guess, when you're initially meeting someone and they say, oh, yeah, sleep's always been terrible.
Yes.
I'm like, hey, hold on a second. Let's go back. That's usually somewhere where I would start to chat about that a lot more.
Yeah.
So if a clinician wants to get better at addressing sleep or learning about sleep, what would you suggest they do?
Come to our PD booster. I also did a PD, I think it's through Sleepability, and one of our other OTs has done a 2-day course through Sleepability as well, and I had lots of takeaways from there.
Yeah, and I think if you're not ready for like a PD just yet, I think there's some really good sites that you can refer to just for that sort of foundational understanding, and they're also really useful to send to families as well. But things like the Sleep Foundation website, Royal Children's Hospital have quite a few things as well. But yeah, there's quite good information out there online as a bit of a starting point, just to sort of understand the language around sleep as well.
I'd also say just focus on your assessment, because that's going to set you up for success. If you're jumping into strategies just here and there and trying a few things, I think the puzzle that we've been speaking about. It's never going to be fully complete. So yeah, focusing on assessments that it can guide you in every sort of area that's impacting on sleep.
Infant Sleep Australia also has a really good podcast for
Yes.
preschoolers and babies, and they touch on a lot of really good topics to do with sleep and settling and all of these kinds of things. So I know as a mum, but also a clinician, I found that a really interesting podcast, and the hosts are very evidence-based in their approach. Like they've done PhDs in areas to do with child development and sleep. So I think filtering through the noise when it comes to like sleep consultants and advice and
Yep.
free things and Instagram pages, there's a lot of misinformation, particularly around sleep. So
Especially on TikTok too, there's a lot
oh,
of
isn't it?
information to filter through on TikTok,
Yeah.
which we're all
Yeah.
using these days.
So as clinicians, like apply your clinical reasoning and really, I guess, fact check some of your resources as well, like you would with any other area. But in certain goal areas, there's more noise than others. So I think we have to be really careful when it comes to sleep. Any final takeaways? Like what's one thing that you just wish every clinician or family knew about sleep?
I think for me, again, coming back to sleep is a learned occupation. Like kids need to learn how to sleep and learn how to sleep well.
I would say if there's any problems within sleep, work on it.
Yeah.
Like that's a really good place to start.
Yeah.
You might
Sleep
do
difficulties
yeah.
are treatable.
Yes, and you might do so much other work on daily occupations or skill building throughout the day, but I do genuinely find if sleep is a problem, then it's always going to have impacts throughout the day.
I think I'm going to combine two, but assessment, and that ties into learning about the child's individual sleep need preferences and building a plan based on those two things.
Love
that.
it.
Thanks for joining us. Thanks for the chat.
Thank
Thanks,
you.
Jack.
See ya.